Hi everyone, welcome back. I'm Gabby, aka Dr. G. I like when patients call me Dr. Gabby, and some of you know Miss Moon Picasso. And today, I want you to take a deep breath in with me because we're not going to be rushing anything. And I know sometimes my voice can get a little rushy. I don't know why, but that's just how God made me. So today we're not fixing wounds. We're not fixing wounds today, and we're not fighting skin. We're going to do something different. We're going to grow skin, okay? And that's going to be another name I'll give myself. Gabby, that's a Gabby the skin gardener. So you might see skin sometimes as painting or gardening. And the only reason I started to think about skin gardening is because I got kind of into it, gardening. But with gardening, you don't force it, you don't yell at it, you have to create the right environment for it. And that's pretty much what we have to do with every wound. Every wound is just a little unhappy. And when it comes to skin gardening, there's no mistake. And I'm not talking about gardening plant products so that can help the skin. I'm talking about us actually growing skin. And so today we're going to learn how to care for the soil, like of the skin, and how to water the skin, and how to protect it from harsh weather. And, let's get into how skin grows back layer by layer and cell by cell. So, if you ever wondered why some wounds heal beautifully while others struggle, it's not because the skin is broken, it's because the garden needs a little love. So let's pull up a chair, get comfortable, and let's do some gardening. So episode is called Skin Gardening 101 with Dr. Gabby. Okay. So, skin is a living ecosystem, okay? And wounds, especially diabetic foot ulcers, are not failures of skin. They are failures of the garden that the skin depends on. So, today we're going to become little skin gardeners. So, first, like I always do, I love to learn the history of it, makes you understand it better, okay? So, early human understanding of the skin. They didn't even know the skin was actual full organ, right? So skin. When people think of skin, what do you think of? Protection, identity, because we're identified by our skin color. Isn't that interesting? And survival. People think of scars, tattooing, body paint, you know? And healers used to notice that some wounds closed, some wounds rotted, and some wounds killed their host, like the person died. And in ancient medicine, Egyptians used honey, resins, linen. The Greeks balanced the humors. The Romans did wound cleaning and compression. And the indigenous cultures, they use more like plant-based antimicrobial. But the key insight is that humans knew that skin regenerated long before they knew why. So before diabetes had a name, long before the phase of diabetic foot ulcer existed, the condition did exist back then. And ancient physicians described like diabetes with like sweet urine, wasting bodies, infection that won't heal, blackened toes, limbs that rotted. And in ancient Egypt, the healers noticed that some wounds healed with honey and linen, and others became foul, dark, and fatal. That's why you have I always tell people it's not one recipe when it comes to healing wounds. Some need honey. Sometimes honey makes it worse for the wound. You have to know. That's why it's a specialty. Okay? So, when it comes to the science of like the foot, right? Becoming a fatal organ when they're kind of realizing the history kind of about diabetic foot ulcers. Like by the 1700s or the 1800s, doctors started describing spontaneous gangrene, frank gangrene of the toes, mortification of the extremities. And of course, amputation was quite common in that time. And remember, they didn't have any analgesiacs, something for pain, okay? And it was quite terrifying. They didn't have antibiotics yet. They didn't have anesthesia. They had a high mortality rate. And the surgeons noticed the pattern that diabetic patients healed poorly after amputations, and many actually just died after surgery. And this was kind of like a first cue that the problem wasn't just the body, the problem was the biology of the patient. So, also, one of the biggest missing pieces when they were trying to understand diabetes and diabetic foot ulcers and wounds when it comes to diabetes, patients that had burns on themselves or stepped on nails without pain and developed ulcers without any injury memory, right? And that's kind of when they started identifying neuropathy. And that was very revolutionary for it because the foot was not weak, the foot was numb. And pressure plus numbness equals skin breakdown, and repetitive trauma without pain equals chronic ulcers. So in the 1940s, this is quite recent, in the 1940s and 1960s, vascular medicine exploded, and doctors discovered atherosclerosis, microangiopathy, capillary basement membrane thickening, and diabetic feet were starved of oxygen, unable to deliver immune cells, incapable of rebuilding skin. And, you know, this helped create the diabetic foot triad, which was neuropathy, ischemia, and infection. So, the diabetic foot ulcer wasn't just a lesion, it was a system failure. Yes, it's a system failure in the healthcare system, but it's also a system failure in the body physiology, the neuropathy, the ischemia, and the infection. And we'll get like later into diabetes, okay? When it comes to like antibiotics and everything. But the skin discovering that the skin is an organ, the skin became scientific. So from the 17th century to the 19th century of anatomy, the they looked at the skin with the microscope and revealed that the skin had layers. And skin became recognized, like I said, as a barrier. Skin became recognized as an immune system organ, sensory system organ, and an endocrine participant. So this was the moment that skin stopped being what they called wrapping, like a wrapping around our body. Okay. Once they saw that the cells were dividing underneath the skin, like the cells of the skin were dividing, the skin became a factory and not a fabric. So let's talk about the architecture of skin, the garden of skin. Okay. So let's get into skin gardening. I feel like I should be painting or using a whiteboard right now. But so everybody knows about the epidermis, the first layer. Epidermis is like the crops. What's in the epidermis? What cells are in there? The keratinocytes, the melanocytes, the Langerhans cells, which are like me likey, and the Merkel cells. Then we have the basement membrane, which I consider the irrigation system. They have laminin, they have collagen 4, and then they have the integrins. And then the next layer, the third layer is the dermis. The dermis has the fibroblasts, the collagen type 1 and collagen type 3. Remember, that's a big deal when it comes to healing the wounds and the phases, right? Elastins and the amyloglycans, okay? And then the next layer is the hypodermis, and I consider this the climate buffer. It has the adipocytes, which are the fat cells. It has immune signaling in it and shock absorption. So when it comes to skin gardening analogy, you don't grow plants by yelling at them, at the leaves, right? You fix the soil. So let's become gardeners. Let's go more in depth into the layers. Okay? I feel like I just want to be painting at this time. I don't know why I keep on saying that. So let's go more in depth into the epidermis. So the epidermis are our crops, okay? And you have to remember the epidermis has no blood supply. That's when we're like cutting a callus and it's not bleeding. That's the epidermis. The epidermis has no blood supply. I mean, everything here survives by diffusion, signaling, and perfect organization. That alone tells you how fragile the epidermis is, but the epidermis is brilliant in its own way. So, what cell makes up 90% of the epidermis? The keratinocytes. These I consider are the farmers and the builders. What do? The keratinocytes. They constantly divide. they produce keratin, which is a structural protein. They create a physical barrier and migrate to close wounds. That's what we want. And the life cycle of the keratinocytes, they are born in the basal layer, they move upwards, they flatten, they die on purpose and become an armor. So the keratinocytes are born to die so that you can live. And in wounds, they crawl, they don't jump. They need moisture, they need oxygen, they need glucose balance, and it fails in diabetics due to the poor signaling of these keratinocytes to, come together and crawl to close a wound, right? Next in the epidermis is the melanocytes. This is what I consider the sun engineers or the DNA protectors. What do the melanocytes do? Everybody knows like melanin, right? So it produces melanin. It protects the nuclear DNA from UV damage. It signals stress to nearby keratinocytes. But the important insight is that melanocytes do not determine healing ability, but inflammation affects the pigmentation during the signaling. So skin color isn't just cosmetic, it's a protective engineering. Next in the epidermis is the Langerhans cells. I like Langerhans cells because they're they're immune cells. So they're like border patrol. They detect the pathogens, and this is in the epidermis, okay? They protect the pathogens. They not protect, they detect, forgive me. They detect the pathogens, they present antigens to the immune system and decide when inflammation starts. And in diabetes, there is reduced function of the Langerhans cells, and there's delayed immune response, and that's another reason why infection can sneak up so quietly. Because in diabetic skin, the Langerhans, what are the guards of the skin, they get tired. They're lazy a little bit. Okay. Next in the epidermis is the Merkel cells. The Merkel cells are the sensory translator. And what do? The Merkel cells, they detect fine touch and pressure, and they communicate with the nerve endings. And why does that matter? Because remember, pressure sensing protects skin and neuropathy silence the warning system. So no sensation means no self-defense. Next layer, our second layer of skin, the basement membrane, which we consider the irrigation system. And the basement membrane is one of the most ignored, but yet one of the most important layers in wound care. And what does the basement membrane does? It anchors the epidermis to the dermis. It transfers oxygen and nutrients. It sends signals, healing signals, and it guides the keratinocytes migration. So, what are some of the key components in the basement membrane? Are the collagen 4, the laminin, the integrins, and the fibronectin. And in diabetics, it's thickened, it's glycated, and the signals are broken. And in the basement membrane, when the basement membrane fails, the skin can't reattach, no matter how good the dressing is. So think about that. Our third layer of our skin is the dermis, aka our soil. So what is in the dermis? The fibroblasts. Fibroblasts, what are those? And that's a big thing. We need the fibroblasts during the proliferative phase, right? So the fibroblasts are the master builders. And what do? They produce collagen, they produce elastin, they create an extracellular matrix, they help contract the wounds. And what do fibroblasts need? They need oxygen, they need vitamin C, they need mechanical stability, and they need proper glucose levels. And in diabetics, the fibroblasts are slow, they're dysfunctional, and they have poor collagen quality. So fibroblasts don't just fail randomly, they fail when the environment fails them. Next is the endothelial cells, the road builders. What do the endothelial cells do? They form blood vessels, they help deliver oxygen, they remove waste, and they enable angiogenesis. And in wounds, they help sprout new vessels and require nitric oxide. And everybody knows nitric oxide because like right? But it increases blood flow. We need that. And in diabetics, the vessels are stiff, they're narrowed, and non-responsive. So no roads means no supplies, means no healing. Next, cells that are one of the key factors also are mast cells, MAST, the fire starters. What do the mast cells do? They release histamines, they control inflammation, and they regulate early wound response. The problem is if you have too much mast cells, it causes chronic inflammation, which is something that a lot of diabetics are constantly stuck in that phase. And if you have too little, it's poor signaling because inflammation is not the enemy, actually. Uncontrolled inflammation is the enemy. Inflammation is actually good to an extent, okay? But if it's uncontrolled, it's bad. Then there's the macrophages, our cleanup crew, our foremen. And what do? The macrophages, they remove the debris. Remember, we wanted to move from M1 to M2. The macrophages kill the bacteria, they release the growth factors, which we love, and they signal next healing phase. Okay, so that's why we need the diabetic ulcer to go from macrophage 1 to macrophage 2. So in diabetics, they're stuck in the inflammatory mode. So that's why they're like, I want to be number one, I'm M1. And they don't transition into repair mode, which is M2. And the wound stalls when the macrophages forget how to switch jobs. Next layer is, and I think last layer, the hypodermis. This is where we do like, aka what I call climate control. So the adipocytes, okay, the fat cells. These are the shock absorbers. These are hormone factory areas. And what do? They cushion for pressure. They produce the cytokines. They influence inflammation, and they affect the insulin sensitivity. And in a foot, we talk about fat pad atrophy, and that makes people at higher risk of ulceration. And compression damages also the microcirculation of the area. So fat isn't just passive, it's a biologically loud, it's cushion, okay? So how do all of these cells talk to each other? Okay, remember, it's not just a multidisciplinary team outside with the healthcare system. It's a multidisciplinary team in your body as well. Okay, all of them have to work together. So healing requires cell communication, growth factor gradients, oxygen diffusion, mechanical stability, and time. And in diabetics, the signals are distorted, messages arrive late or even never, and the garden becomes chaotic. And the wound is not just a hole, it's like a breakdown in the conversation. So, where is the skin the strongest? Okay, guess. And it's very interesting. The strongest skin in the human body is on the plantar foot, which is where we treat. So we're treating the strongest area of the skin that became pretty much so weak. The heel, and the palm. Those are the strongest areas. That's the strongest skin on the human body. The plantar aspect of the foot, the heel, and the hands, the palm of your hands. And why is that? Because they have a thick stratum corneum. They have dense collagen along that area, and those areas of skin are designed for load, not really healing, for load. So the strongest skin breaks down the worst when circulation fails. So, how does the body make skin? How does our garden make skin? So, step by step, stem cells, they divide in the basal layer. The keratinocytes differentiate. Then protein synthesis happens with like keratin and philogernin, I think. And then there is a lipid barrier formation, and then control cell death, and they turn into like cornocytes. And the key molecules of that are the growth factors like EGF, PDGF, TGF beta, oxygen, glucose when it's balanced, amino acids, zinc, copper, vitamin C. But the key factor of this, so everybody can understand, is that skin is manufactured. It's not repaired. It's actually manufactured. So a little bit about what skin form, because you have to remember skin is formed in the body, like when we're babies, like in our mommy's tummy. So skin formation during pregnancy. Fetal skin development comes from the ectoderm origin, and there is rapid keratinocyte turnover, high levels of hyaluronic acid and scarless healing. Like it's a scarless healing environment. That's why fetuses heal without scars, okay? Because there's low inflammation, there's high hyaluronic acid, there's rapid cell signaling, and there's no chronic hypoxia. And what is the lesson that we can learn today? The closer we get to fetal biology, the better we can heal wounds. And that's why they play a huge role when it comes to stem cells as well, okay? So, how does our skin garden get destroyed when we have diabetes? So, diabetes damages the skin by microangiopathy, advanced glycation end products, impaired nitric oxide, chronic inflammation, stem cell exhaustion. And what fails first? What fails first when it comes to diabetic foot ulcer? The basement membrane breakdown, the fibroblast signaling breaks down and fails, and then angiogenesis fails. So diabetic foot ulcers don't fail at the surface, they fail underground. So keep that in mind. So there, we all know anybody who is a wound care specialist knows that there are classification systems. And there's a historical evolution to classification systems. I mean, everybody who knows the diabetic ulcer mostly knows the Wagner scale. There's the University of Texas scale, and then there's the Wi-Fi scale, which is like wound ischemia infection. And classification systems evolved as they realized ulcers are ecosystems and not just holes in the body. So, what are the principal factors that we need to help grow skin in a normal person? We need oxygen, we need perfusion, we need protein, we need mechanical offloading, and we need moisture balance. And what are the tools that we use for that? Debridement, dressing, growth factor signaling, and mechanical protection, aka offloading. Okay. So, how do we grow skin in a diabetic patient? Because this is advanced skin gardening. So, in a diabetic patient, you have to have strategy in gardening, okay? The skin. So, in a diabetic skin, we have to repair the circulation, we have to control the glucose, we have to replace the missing signals, we have to reduce the inflammation and provide a scaffold for skin. And in vitro, the keratinocytes culture, the fibroblasts mixed matrices. There are bioengineered skin, and then there's collagen and hyaluronic acid scaffolds, okay, that you can use. And you can't grow roses in poison soil. So that's why debridement is such a huge deal. Removing infection is a huge deal. So, what is the future of skin gardening when it comes to wound care? Stem cells, see why they don't scar. Bio 3D printing, which is amazing, gene guided healing, and personalized wound medicine. That's why I feel like all my patients, like I find them very personalized when it comes to wound care. So I don't think this is going to be the last episode of Skin Guardian 101. I mean, the biggest thing is perfusion, vascular, okay? I see it as the sun. Blood flow is like the sun. And debridement, remember you gotta move all the weeds, all the things so that it can make good roots and heal. So skin is not something we just patch up. Skin, literally, we are skin gardeners. And skin is something we grow. Remember, it's manufactured. So when we treat wounds like artists, like respecting the soil, respecting the water, the nutrients, the timing, we're not just chasing the ulcer, we're cultivating the healing and growing skin. So this is Skin Gardening 101. I'm Dr. Gabby, Dr. G, and this is Diabetic Foot Files, where we don't just close wounds, we're growing skin. And take care of your feet because they take care of you.